Let's talk about what are some things we want to be thinking about in perimenopause. I mentioned a couple of them already, but I'm thinking about this more from like a physical perspective. I feel myself when I'm coming down, let's say when I'm doing a squat or a lunge where I'm increasing that intra-abdominal pressure. I don't have any issue there, but I know I've had women who've DM'd me on Instagram. They're like, I don't know how you squat, what you do. Like I pee. Like every time I squat, I pee. So what are some things if we are, if strength training is on the menu, but every time they're, either some type of burst training, like some type of high intensity interval training, or they're lunging or whatever, what are the recommendations there? Do we have to back off of that either in weight, volume, intensity until we can recreate or create some stability in the area? What is the best recommendation there if that's something that someone's dealing with?
Such a great question. And, I love fitness and I'm such a huge fan of it. And even now I'm in the same camp as you. We need to build muscle strength, and pulling your pelvic floor into the workouts you're already doing is so essential. So when you're squatting, you need to be activating, sucking up that smoothie with your vagina, zipping up your pelvic floor before you even start moving. Remember, this muscle's getting tired. It works all day to support our posture. So you need to be activating it or pre-contracting it before an exercise, and exhaling. So avoid holding your breath. The other thing is that if you're experiencing leakage, prolapse, pain during an exercise or at some point in your workout, that means your tissues are being pushed past what they can hold. So yes, the recommendation is to pull back, drop your weight, drop how quickly you're doing your moves, slow it down, make sure that you're using optimal posture and mechanics and breathing and pre-contractions. And then you want to build up your pelvic floor strength before you kind of increase it. The other thing is, I'll give everybody a hack here. There are these things called internal bladder support. So if you're leaking, it's likely because your bladder is pushing into your vaginal walls because your pelvic floor is weak. And so all of that pressure is causing leakage. You can insert a tampon or a pessary, which is prescribed by a medical provider, or an over-the-counter bladder support. There's one called Revive. There's one called Poison Preza. And it looks just like a tampon that you kind of insert in there, but it just props up your pelvic floor and your vaginal walls to support the bladder. And that may help you give you more support while you're lifting and loading and make a world of difference. You still need to work on your pelvic floor. You still need to strengthen. You still need to activate. You still need to breathe properly. But that at least just kind of takes some of the fatigue off of the muscles while you're trying to strength train. So the other thing is, look at how you're moving. A lot of people, when they are postpartum or getting into working out, I'm like, start in sitting. You've got pelvic floor support in sitting. Do some things in sitting where you don't have all of that gravity pushing down. Get into hands and knees position, planks, side planks, mountain climbers, use an incline bench. So there's a lot of ways to modify things before we get into a way upright position and load and impact. So a lot of variations. I have a whole online pelvic floor program to really get people back to running and lifting, showing them how start, it feels easy, but really build that foundation before you just start kind of building the house and loading things on top of it.
Okay, that's awesome. We'll make sure that link is there too. And thoughts on Pilates for improving core strength? Do you like it? Not
love
like
it.
Neutral? Love it.
Yeah, I love Pilates. I think it's great. But again, you have to be pulling the pelvic floor in, and you also have to be relaxing the pelvic floor afterwards. I think Pilates, bar, a lot of these workouts are all about tightening, and you do that for an hour. But afterwards, you also have to relax the pelvic floor. You need to soften it. You need to balance it. You need to do some stretching and breathing to make sure that it gets back to its optimal resting tone. And I think that's what I see is with Pilates and bar, they're great, but the focus has to be on balance and not just on tightening.
Yeah, that's why I love Happy Baby. I love Happy Baby pose.
Love Happy Baby.
I actually do it before and after my Pilates class. It feels
which is so great.
Good. Yeah.
It's a great one because even, we walk around with a lot of tension in our body. So doing a little bit of breathing and stretching before the workout, so your pelvic floor is an optimal length. Do your workout and then do it afterwards. Do the stretching afterwards as well, or do it before bedtime. We walk around with so much tension in our bodies from sitting, from stress, from waiting in the carpool line to get my kid, from just life, from just modern day life. And that creates tension in our bodies, right? Yeah. And so just giving your body the opportunity to soften and relax is as important as the strengthening and tightening.
I've seen a lot of, this is more power lifters, but I've seen some women do this too, where they're wearing belts when they're squatting, and this might be for an axial squat. So like you're having a barbell on the back, so you're like loading the spine, which is not for everyone. So there's lots of different ways to squat. You can squat with your hands at the side. You can do a belt loaded squat. Lots of different ways to squat, but particularly with axial loaded squats, where the barbell's on the shoulders in some capacity, high or low bar. I see a lot of belts, and I think that I don't wear one, but what I've garnered just from listening to people talk is that it helps them to sort of breathe out and brace almost against. So having like a physical brace against something as you're coming down in the squat. Is that something that you like, don't like? I'm just throwing a little bit of
it's a great
rapid
question.
Fire at you. Yeah.
No, I would say I don't like them when the mechanics are wrong. So we talked a little bit earlier about that intra-abdominal pressure, and ultimately what those belts do is they try to direct where the pressure's going. They're trying to prevent it from going to the back or prevent it from going to the abs. Well, where's it going to go? Down.
Yeah. The
right?
pelvic floor,
the pelvic floor, which is why
exactly.
people leak and they have hemorrhoids and they have prolapse and rectal prolapse when they do that. So it's, it's a little bit, I know that people are making those choices because the lifting is important to them. And I'm like, girl, you do you. Like, you are a powerhouse and go for it. But I want to tell you, it will catch up with you over time. So as long as you know that and you're making an informed choice versus being like, oh, I just peed my pants. Well, I'm actually like, well, now your bladder's falling out of your vagina because of this repetitive lifting and poor mechanics. So that's, as long as you're aware of that's the situation, and you will have to likely have it surgically, corrected. And 30% of women who have their prolapse surgically corrected have to get it redone because they're not getting therapy after. They keep doing the same things. Just know that that's what's happening. And so I'm like, I get that that's going to happen, but I just do want people to be aware of why it's happening so they can understand their bodies.
Okay, so the other thing I have to bring up, because I get asked this all the time, is waist trainers.
Oh.
So these sort of like corsets that appear to make your waist look smaller. And I think as you were talking, I'm like, oh, this is what I actually think a waist trainer is doing, because it's squeezing you in at the waist. Thing. But it's like, where is the pressure?
Where's the pressure going?
Yes, tell us about that. So
I'm not a fan of waist trainers. So.
Okay.
Because, when they often happen, when we often use them is after giving birth, and we want to shrink our waist down. Well, think of like you're holding those, those long skinny balloons that they use to like make the little, wiener dogs or whatever, balloon animals. Think if you've got one of those long skinny balloons, and that's your kind of intra-abdominal cavity with all the pressure. If you take that balloon and you squeeze it in the middle, where's all that pressure going to go? Up and down, right? Well, after giving birth, when we use these waist trainers and squeeze our middles, all of that pressure goes down on a really vulnerable pelvic floor. And your pelvic floor is functioning at less than 50% at 6 weeks postpartum. So you're putting all of this pressure down on it when it's in a really vulnerable, weakened state. And I've had women be like, yeah, I wore this, and then I bent over and I peed my pants. I'm like, because there's so much pressure going down on your pelvic floor because it doesn't have anywhere to go because you're cinching your waist in. What I really love for postpartum is compression from the bottom up. So there are these amazing supports that you can have where they go under, they're like underwear, but they go below your pelvic floor and they lift up. So they kind of like pull you up and in, and it's a gentle compression. It's like a little sports bra for your vagina, your vulva, and your core. But it's not a trainer. It doesn't have, bra cinchers or snaps. It's compressive and supportive. And, I think if we build in pelvic floor and core retraining in these early days and those first 12 weeks, it's going to help people have more of that internal support than trying to rely on these external supports, which could be potentially, not helping and even harming. But compression, vaginal support, vulvar support, abdominal gentle compression, but not a waist trainer.
I love that. I love that reframe, because I'm asked a lot about waist trainers. Do they work? Should we wear them? And I just feel like if you have a stronger core, which includes the pelvic floor, your waist, and then you have the right diet and the right movement pattern, the right stress management, you're going to have a beautiful waist. And then if you're building your glutes and you're building your quads, you have that beautiful quad sweep and calves that you want to take a bite out of. Like you're gonna be fine. Like your waist is gonna be like chef's kiss. But I do think that there's a lot of products around this idea, like get your baby body, your pre-baby body back, or even just in, I pay attention to physique competitors.
Yeah.
Like the physique competitors are always selling some kind of waist trainer.
Yeah.
And that's like that's the key or whatever, at least that's how they sell it. Like that's the key to their competition prep or whatever. And I don't actually think, I mean, maybe it is, I don't know. Competing is an extreme sport, so that's sort of an outlier. But I do
Right.
think for the general population, a waist trainer is not, even for some of the purported benefits around posture, which you've mentioned a couple of times.
Yeah.
And maybe we can go there now. I don't think that the waist trainer even provides the right type of, I mean, it might provide like a physical reminder if you're like slouching over and
Sit
then the
up,
waist,
yeah.
like to sit up because the material is crunching. But what are some things that we can think about either training in the gym or at home, or ways that we can improve our posture as we age? Because that's a big thing I would see in practice. I'd have women coming in saying, I don't want to look like my mom. Like
I
my mom looked, she looked rolled over. She had this big dowager hump. How do I not look like that when I
Well, it's
age?
so hard now. I mean, who doesn't have like tech neck and is looking down at a computer or on their phone like 50% of the day? So,
Right.
what really, so from a pelvic floor perspective, the pelvic floor works best in what we call a neutral spine, which is when your ribs are stacked over your pelvis. So that's when I'm kind of sitting upright. I'm not super arched back. I'm not like sticking my butt in my chest out, but I'm also not rounded, sitting in what we call a sacral sitting posture, where I'm kind of like rolled forward. It's just your ribs are stacked over your pelvis. And so one of the ways I actually tell people is to put on a sports bra and have on a pair of pants or a pair of underwear. And the base of your sports bra, the bottom line, should be parallel with your underwear, right? So if you're sticking your butt out, it's like, oh, there's actually it's going to be shorter in the back and longer in the front. Or if you're sacral sitting, it's like, oh, the front's crunched down, the front of the sports bra is touching closer to the underwear, and then the back is really long. So and this is the posture you should have when you're working out. So you want that nice neutral spine position, and that's going to give that pelvic floor space to activate. And that's actually how we should be sitting during the day. But I'm short, so I'll sit on my couch and my feet don't hit the floor. So I put a pillow behind my back to kind of keep myself upright. I have like the most nerdy car setup where it's like a really up back and and it's like I'm so close to the steering wheel. And I even watch my kids. I mean, my kids are on screens and I'm like, oh my gosh, this kid is already having like rounded shoulders. And I'm like, put a pillow behind your back, lift your computer onto your lap desk. And because these repetitive postures affect how we breathe, they affect our pelvic floor, they affect our core strength. And this is what I think is so important, and what I really try to nail down in the book is like, you can do all of these exercises all day, but if you're just not looking at the daily habits you have and making these small adjustments, then it's kind of like, it is like you're swimming upstream, because some of these things are just really simple and basic and easy to adjust, but they go a really long way. And so, with waist trainers, again, it's one of those things where that's why I love compression. I want to give something where people feel like they've got a little bit of, something pulling their tummy in. I remember pulling my postpartum leggings like over my belly because I just felt like I needed a hug. And that's really what you're looking for, is that gentle hug in while you activate your inner core versus a squeeze and pressure down.
And you were saying the vaginal or the vulvar compression, is that underwear? What is that? I've never heard of that before.
It looks like underwear, but it's like a girdle almost, but it pulls up. It's like underwear that goes really high, right? It's like a high-waisted underwear, so it comes up, but it's a compressive nature. It's almost like a sports bra-like material. My favorite brand is called Love Steady. They have amazing postpartum ones. There's another one called Hem Support Wear. All of these kind of just like give your pelvic floor and vulva a hug, because there's swelling down there as well postpartum. But at any time, I mean, I have a woman who's postmenopausal right now, and she doesn't have great posture. And she's like, I feel like I have a little bit of diastasis, but I also have prolapse in my history. And so we got her a pair of these Love Steady bloomers, and just to kind of help pull her pelvic floor in and give her a little bit of compression that feels really nice and cozy, but it's not so tight that it's squeezing you.
And you could use that when you're working out.
Oh, yes, absolutely. When you're walking, when you're working out, you can wear it all day. I just tell people don't wear it when you're sleeping. You don't need it when you're sleeping.
Right. And that's sort of the time when you'd want there to be like that laying egg that you were talking about, like that relaxed and open.
Yeah.
Beautiful.
Yeah. So one of my favorite ways I teach people to poop is, I talk about blowing to relax the pelvic floor muscles. Again, something we're never taught to do, but thinking about laying an egg. So like when you're pooping and they're like, I don't know how to push. I'm like, just think about laying an egg and like that sphincter opening up. And that's how we teach people to give birth as well. Like we're never really taught how to birth. You just kind of get into this room with like doctors and a lot of lights, and they're like screaming at you to push. I'm like, well, nobody's taught you how to push. And now you're in this really vulnerable, overwhelming situation, potentially medicated. This is why it's so important to help women during these processes understand their bodies and learn how to use them so that we decrease the risk of pelvic floor issues.
And with that laying egg, that would also apply. So if someone is having the UTIs that we were talking about, the painful orgasms, the tampon insertions, painful, all the sort of signs and symptoms that someone might have a tighter pelvic floor, that might be, it's like the test is sometimes also the therapy, right? That would also be something that we would be encouraging women to be doing as a way, that laying egg, bearing down, opening up and stretching. That would be something that would be, I mean, there was also massages and there was tools in the book, but yeah.
I would say the laying an egg, it's a little bit more functional. Like you don't want to walk around kind of pushing your pelvic floor out all day. But I think when you are using the restroom or you're trying, like in a very functional way, times that you need to really relax your pelvic floor, that's what you would want to do. If you're trying to insert a tampon or insert a dilator or have a bowel movement, I want you to practice that laying the egg. And I tell people, which is a very big ask of me, to like take a mirror. Like you need to see, it's called biofeedback. You need to see how your body is responding to what you're trying to communicate with it. So if you do a Kegel contraction or a pelvic floor contraction, you should see the pelvic floor muscles kind of tighten and your butthole pull up and your vagina close. When you push out or laying egg or bear down, which is what you're doing with a bowel movement, you should see the anal sphincter open up and push towards your feet. So we can't see what's going on down there. So often taking a mirror and just looking is an easy way to do it.
Oh, I'm so happy you said that. I think that it's such a simple thing, but it's so elegant in its solution, right? How many women listening, be honest, have taken a hand mirror and actually examined yourself? I think that so many, comes back to what we were talking about before, this like shrouded in shame, right? It's like you have the incontinence liners at the pharmacy and here's the medications for an overactive bladder with the promise for, a better life on, you have all these, these medicines that are being, in commercials that you see in between your, your shows or whatever, even like the scented vaginal washes, there's no, douching, no, never.
No douching,
never.
Even just cleansing, it should be very mild, gentle, even sometimes water's fine.